Next we have Dan Perrin.
Thank you, Congressman, for putting this together. And thank President Trump for putting health care back on the Republican agenda. If he hadn't been so insistent on, as Talento put it, intuiting the idea that the money needs to avoid the insurance company and go to the individual, we wouldn't be standing here today. And that idea goes back to the start of the HSA movement. HSAs were designed to take money that would have been going to an insurance company and instead put it in the pocket of the individual. The way you would do that is you would increase the deductible and it would lower the premium, and that lower premium would create the savings that you would put into the account. So literally money that was going to the insurer would go to your savings account so you could meet the higher deductible. If you dropped the premium by $4,000, it freed up $4,000. That would go into the savings account, and if you had a $3,000 deductible, that $4,000 would pay the deductible. So really, we've come full circle with President Trump's idea of putting money in the pocket of the individual. And the point of that is that you spend money differently if it's your own. So if I go on I'm a Republican healthcare lobbyist, by the way. And if I go on a dinner and somebody else is paying for it, I'll order differently than if I'm paying for it. And that is, in essence, the idea of a health savings account. I have 6 kids, and when I'd go to a amusement park, when I was a young father, I would give them each $25. That's for the day. They'd come back with cotton candy all over their face in 2 hours saying, "Dad, can I have some more money?" So I decided to change that and say, here's $30, and what you don't spend, you can keep. And so the record was, one of my daughters spent $2 on a drink, kept 28. So that's how what President Trump is talking about, empowering the individual, actually works in the economic reality of healthcare. And what we're really doing is we're increasing individuals' buying power by their tax bracket, by their income tax bracket. Some people don't pay income tax, but everybody pays FICA. So you get a tax break for the money to pay your deductible. And let's face it, the ACA is designed with a bias in mind: give money to insurers. If you look at some of the deductibles in the ACA now, 10, 9, 8, 12, $16,000. And nobody's got that money just lying around. So we need to help people in Obamacare, in the ACA, by giving them money to be able to meet these really high deductibles. Now, I'll just say one more thing about the idea of a high deductible plan and why we've got to divorce it from an HSA. Back in the day, nobody had a high deductible. Now everybody has a deductible that will meet the minimum HSA requirements. But because of the plan designs, only about 10% of people actually qualify to be able to open an HSA. So when Uber did a test in Austin about drivers being able to tip into passengers being able to tip into a driver's HSA, hey, I'm saving for my daughter's braces, can you put your tip into my HSA? There are only 10% of the drivers who are qualified to have an HSA. So this is all being tied back together with the opportunity of reconciliation. And our position is reconciliation should be as big as possible. The precedent has already been set for appropriations. If we're in a shutdown, let's do all the appropriations in 3.0. That way we can make sure the government's funded during midterms. So our position is reconciliation 3.0 a go-go as big as we can. Thank you.
Thank you.